And today topic is a very interesting one to do with reproductive health, whereby reproductive health is a complete physical, mental, and social well-being without necessarily the absence of disease, which relates to reproductive system and its processes. And we are privileged to have Dr. Nicholas with us. And maybe he can start by introducing himself, and then he take us through and explain what is expected in the coming weeks. Karibu sana daktari.
Asante. Good evening, everyone. Thank you for the invitation. I think we're going to have a talk on reproductive health, and as my brother has said, before I continue with the subject, I just want to introduce myself. My name is Nicholas Kariukinjeru. I'm a clinical officer by profession and a lecturer at the Kenya Medical Training College, mainly dealing with chest medicine issues. But as you all know, before you get to specialization, you have no choice but to know how the whole body functions. So welcome. I hope you learn a lot, even as we endeavor to discuss the subject, this very interesting subject of reproductive health.
Fantastic. Juan Douglas.
Yes, James.
Yeah, I think. Sorry for interjecting. I thought I thought you'd be the one to do the whole moderation and everything from start to finish. So I think it's just prudent. Is it prudent? What do you suggest? We give Dr. Nicholas the go ahead to start the session, start the training, and then if I think
ama ubebe hivyo achana nayo nichukuliwe na mtu mwingine.
Okay.
I can see there's another visitor called Karen and
achana nayo bani sasa nichukulia.
Karen, welcome. We have started the meeting already.
I have muted her, so we can proceed.
Oh, you have?
I have muted her, but she can yeah.
Okay.
Right. So
yeah, as I said that today is a test run. So I didn't have much to moderate on, but my brother can proceed from, he can proceed.
Okay. Before Dr. Nicholas, I was suggesting that the first would be the introduction. Moderator will introduce, just like you've done, for the future session. And then the speaker, Dr. Nicholas, will take over. And then we can have a brief question and answer session at the end of the session before the moderator takes in. What do you suggest?
Okay, that is in order.
All right.
Okay, let me first take this opportunity to introduce myself. I'm Douglas Wamwiri, founder of Matters Health Association, whereby we deal with all matters that relate to health. And as we know that health is very important. Without health, we cannot function properly. And there's a phrase that says, health is wealth. So this forum is to educate, remind, and emphasize on matters to do with health so that we may know how to take care of ourselves. We are privileged to have Dr. with us. I can also see that we have two participants. That is Joy Nyambura that's my daughter, and Karen Kemotho, my colleague at work. Welcome into this group. Feel free and let us all participate and ask questions. And I would like at this juncture to hand over to Daktari to proceed from there.
Thank you, Douglas. And thank you for the host of the evening. So let's when it comes to matters reproductive health, it's important to understand that matters reproductive health, these are issues that really address our well-being. And when we talk about reproductive health, we're talking about our sexual organs and how we function and how we can be able to have a healthy reproductive life. Now, needless to say, this is something that starts at a very tender age. And at times you even say that reproductive health starts at conception. So when a mother gets, or even we like looking at it from a different perspective. When a mother is planning to get pregnant, or yes, they need to do a few things so that they make sure that they have a healthy offspring, let me call it that, so that by the time the conception is taking place, it can take place in an environment that is healthy. And that is why most often than not, we encourage people before they start thinking about getting children, they go have a medical checkup, they understand their blood group and how healthy they are before even they think of engaging in the act of reproduction. Now, when all that is done, it's prudent to look at it from a different perspective. And that is making sure that they feed well, because first of all, we are what we eat. So if there's anything to do with malnutrition, that means the byproduct, and that does not only include the nutritional health of the mother alone. We are talking about the nutrition health of even the male partner in the relationship. So that at least all the elements and the nutritional factors and values are all inclusive when it comes to the formation of that child. Now, that is matters nutrition. Then we need to look at the other factors to do, or issues to do with genetic makeup. And what do I mean when I talk about issues to do with genetic makeup? Here is where we talk about how the well-being of, or the formation of the reproductive organs. For instance, when a young boy is born, we usually advise mothers to look at things like undescended testes. If then the testes are not descended, then there's that duration we're supposed to wait to see whether it's going to happen naturally. And if it doesn't happen naturally, there's a process that we need to go through so that we make sure before it's too late. That operation is done, and that those organs are operated on and they remain viable. Because if it's not done on time, then that means we could have some damage because of the heat, and that is why the testicles are usually stationed externally in the body, because they don't handle excess heat so well. Now, the other thing is also just looking at when a child is born, both male and female, you need to be very careful and to make sure that the genitalia, that is the reproductive organs, are in place and they are normal. We've seen places where people are born without, if it's ladies, they don't have, the vagina is not really perforated, so it's just some things you're seeing out there. And all those issues, if they're not handled at the right time, that means in future, when it comes to issues reproduction, they may affect that particular individual. So those are two issues we've handled. The other thing we're going to handle is also to try and see how things like infection or infectious conditions, both sexually transmitted and otherwise, how they affect matters reproductive health. And also, these are things that we'll handle, could be in different sessions apart from what you're having today. Issues to do with now reproductive health in relation to men and reproductive health in relation to female reproductive organs, so that we can be able to understand exactly what really matters and even what really counts, and even the facts that at times we see and we've had different members of the society could be complaining or accusing each other, especially in matters to do with the gender or sex of children that are born out of a relationship. And even how, at times it's usually very tricky, but there are ways scientifically a few people can be able to say what you can be able to do to make sure that could be, if you want for a specific gender, what you can be able to do to improve, but not necessarily to say that it has to be that way, but it improves chances of getting either a male or a female child. So I'd want to pause there, and could be, if there's a question up to that particular point, you can ask, then we can continue.
Thank you very much, Dr. Nicholas, for that brief introduction. At this juncture, I would like to request the participants, if you have any question, this is the right time to ask. Jim?
I don't think there is anybody with a question. I think we can proceed. Maybe if anybody has a question, then they may request request that at the end of the session. That's my opinion.
Okay, fine.
Yeah.
That's well noted.
Okay.
So, Dr. I think you can still proceed, because you have given in a nutshell the introduction and what we are looking forward in the coming weeks. So you can proceed from there.
So thank you. So I think we're going to start with the issues or matters. Matters.
Yes, Dr. Sorry. Continue.
Nutrition. And when you're talking about matters nutrition and their effect on the reproductive health, it has been noted scientifically. I'll cite for you at the later date that most of the children who suffered malnutrition when they were young, severe malnutrition, they usually have issues to do with reproductive health. That means in terms of the duration it takes for them to mature. If it's for girls, the duration it takes for them to start having menses, and even for the young men or teenagers, men, male children, for the duration they take for them to start experiencing wet dreams and things like that. It has been shown that it's affected by nutritional health of these particular individuals. So nutrition and reproductive health is something that is very crucial, and all said and done, we need to emphasize, we cannot overemphasize the importance of a balanced diet in every person's life, and also, where applicable, the use of supplements, that is like essential elements like vitamins. You can use multivitamins like omega-3 oils and the related issues. Now, we talked about health, the importance of health, especially in relation to the female gender when they're planning to become pregnant. So we try to emphasize, where applicable, that ladies, before they think of becoming pregnant, or when they're planning to become pregnant, they can even start using supplements at least 3 months in advance, so that issues to do with congenital malformations can be addressed, because we've seen conditions like spina bifida, where, in other words, this is where a child is born with part of the spine or spinal cord exposed or malformed because of just lack of things like folate in the diet. At this particular juncture, I just want to emphasize the importance of not only dietary issues and supplementary issues, which now, and when they do that, I think it does not only, that one helps in the formation of all that, and also the development of the brain. And this has led to very good results in terms of the children who are born out of this kind of preparation and relationships. Usually they are termed to have a better IQ than either of the parents. Now, the other thing is also things to do with matters, infections. When a lady or when a couple is preparing for marriage or copulation, it's usually advisable before any of these things happen, they go and get themselves checked up. And this is not only about the sexual organs alone. We talk about a general body checkup. If they have things to do with high blood pressure, things to do with TB, things to do with any other communicable or non-communicable disease, because they all play a part in the formation or in the art of reproductive health. So we want to leave it at that. And Kobe, when we meet next time, we can expound on those kind of diseases and how to handle them, how to diagnose them, the signs and symptoms, and what could be a layperson would see and know that this is an STI or this is a condition that needs to be treated, and so on and so forth. Because there's even some of these conditions or some infections that a woman, or yes, especially the woman in the relationship, the mother, can get, and that might determine that that child might not be born normally. When I mean normally, I mean through SVD, but they might be forced to get a child through a cesarean section, not because they are not adequate or they are not able to do that, but because you don't want to expose a child to that particular infection. Thank you.
Thanks so much, Daktari. Maybe you have mentioned about nutrition, which plays a very key role because we are what we eat. And science has proved that 70% of the diseases come as a result of nutrition or bad eating. Now, would you emphasize the importance of the first 1,000 days in a child's life from birth? The role that it plays even for the entire duration of the lifespan of an individual.
That's quite interesting. I don't know why you want to know about the first 1,000 days.
Because I have some background as a former medrep, and we were told that the first 1,000 days play a very key role in the kind of a health that the child will experience in his or her lifespan. It plays a very big role.
Yes, mainly this is the period that the development and formation of most of the vital organs are forming, or they're forming. So if they don't, and you know, this is without without proper nutrition, that means some of the elements that are meant to form these organs, they may experience malnutrition. And when you have malnutrition, that means you'll have malformation or malfunction. And so when that happens, then that means in future, when it comes to that offspring developing, or when time comes for that offspring to also reproduce, then they may have their own challenge, because whatever happened at that particular time During those 1,000 days was not really sufficient, or there was some kind of malformation. So the challenges will always be there.
Thank you, Daktari. I can see we have also a new participant, Florence. Welcome. And at this juncture, I would like it to be an open forum whereby the participants are free to ask questions as pertaining to what Daktari has talked about today, or any other question relating to reproductive health. Feel free to ask.
Daktari, that was a very interesting introduction, very informative, very well presented. I'm definitely looking forward to the next session. I have a question. You mentioned about supplements, and briefly, would you what kind of supplements would you, or is there a particular supplement that you would recommend that is, number one, safe, and number two, effective for that whole process for the mother to be taking before and during the 9 months, and the 9 months. Is there? Would you expound on that, or would you recommend something on the same?
Thank you. That's a very good question. I think for expectant mothers or for young mothers who are planning to get pregnant, we talk about ferrous. And in just a minute, I see like I need to plug my laptop into power. It's showing me that it's about to go off. So that's what I'm saying. Things to do with folate, ferrous, and the like, which folic acid, iron, calcium, vitamin D, omega-3 fats, vitamin B, and vitamin C. Those are very, very important elements and vitamins, which really play a major part in the formation of the infant or a child in the mother's womb. So you've asked whether there's anything I recommend. I don't have, okay. There's only, I'm a little bit biased towards that, and at times I don't like recommending any specific brand, but currently there's only one brand in the country that I know is gender sensitive, and that is Centrum. Centrum multivitamins. When you go to the pharmacy or chemist, they usually have different brands of Centrum. You'll find the Centrum for expectant mothers, Centrum for breastfeeding mothers, Centrum for people advanced in age, Centrum for children. So at different levels you'll find, because at different stages in life, in both genders, and you'll find the Centrum for men, Centrum for women. So you'll find the specific category that you need at that particular time, even for what you're talking about, like when you're preparing to get pregnant, you can still go and look for Centrum for those who are preparing for the same.
Wow, very well explained. Thank you very much for that, for answering that question. I think for me that was the only question that arose at the moment. So unless somebody else has a question, for me that's it.
I'm keeping quiet, expecting that one of the participants will ask a question. And I have noted that my brother's laptop power is almost about to nini. So very fast. Any other participant with a question? Sorry, there are no questions. And I would like to take this opportunity to thank you very much for a well-prepared presentation and the introduction, because I believe reproductive health is a very interesting topic and is very broad. And thank you very much. This is just the beginning. And I know that we are going to learn a lot, and we are going to take care of our health as and when advised, and we'll do the necessary. So without much ado, I would like to say thanks so much, Daktari, and also to all the participants. I would also like to say thank you. This is a test run. Otherwise, we are starting the main presentation and next week. And thank you for your participation. We don't take it for granted. Feel appreciated. And Daktari, thanks again. And also James, thanks so much. I would like to say a big thank you to all of us. So James, maybe you can conclude.
Yes. Thank you very much again, Daktari. And thank you for the participants. Thank you for taking your time to make this a success. I mean, this shows it's only the beginning, and we already have this number of participants. We haven't advertised, we haven't started going on social media yet, but this shows that there is the need. People are interested, and I'm sure the future is very bright. So, again, thank you very much, Daktari.
James, check on your mic.
My mic is off.
Mm-hmm.
You're okay, you're audible.
Oh, okay. Yeah, so I think for me that is it. So we'll do the e-flyers and re-advertise, and the participants would request the participants to share widely. Since it's a free forum, I'm sure many people are going to join, and many people are going to benefit. Already, it's interesting, it's enticing, it's engaging. It's very informative. So this is a place to be. So the future is bright. So thank you very much. For me, that's it.
Okay. Thank you. Good night. God bless.
Thank you. God bless all of us. Till we meet again next week. Have a blessed week.
You too.